Now we turn our attention to asthma and our first guest, Dr. Kurt Belk. He's the medical director at the urgency room and a board-certified ER physician. Thank you, doctor, for joining us.
You bet. Thank you for having me.
So our topic is asthma, and I understand this time of year is especially tough on asthma. And why is that?
So multiple factors. It's a lot of the pollens, the dust, the dirt, the molds. People are out of their houses in the springtime. All the flowers and those blooms are allergens for people that have asthma, along with all the things that walk and sting and bite us, and then all the plants that we come in contact with, like poison ivy, oak, and sumac, can all be irritants to the lungs and asthmatics especially.
And I know recently we had a lot of smoke coming down from Canada, and I heard some people saying that was causing even some problems.
Yeah, so the air quality that we breathe in is also one of those things that can certainly be tough on asthmatics, because if you breathe in that air, it can cause the lung linings to react and spasm up and make breathing for those folks really challenging.
And even when it gets very hot and the humidity maybe as well?
Yes.
And then besides ragweed, what are some of you mentioned a couple, what are some of those main triggers?
Yeah, the pollens of all the different flowering plants. If those who have cottonwood trees and dogwood trees, when you see those white things flying through the air, those are particularly hard on folks that have asthma.
Oh, I have been seeing a lot of that. So what would be some of those ways that you would treat or prevent asthma?
There's two main therapies for asthmatics to kind of arm themselves against all of those irritants. And there's a chronic medication that people take is inhaled corticosteroid. And they'll take that usually through one of those metered dose inhalers. Then there's the rescue meds, and that's usually a beta agonist, and that's where you'll see people puffing on their inhalers that they'll take a couple of quick puffs to help them in an emergent situation where they just need a little relief.
And especially at this time of year, we have increased bees in the area throughout the month of August, it seems like.
Yeah, that tends to be...
And September even, too.
Yeah, it tends to be difficult, especially as people warm up and they're drinking their beverages outside. You just got to be careful because the bees tend to swarm into those and fly in, and then if you take a sip, you can get stung.
And I know I mentioned that I know personally 2 young men who had died of asthma attacks. That was the first I even knew that you could possibly die from it. So what are those warning signs, and when should you seek immediate medical care?
So the early warning signs are just difficulty with breathing. You might feel a little heaviness or a tightness, or you might hear a wheeze as you try to breathe, or just with normal walking becomes more difficult where you feel like you need to sit down or feel like you just can't get that deep breath in. Those are some of the early signs, and that progresses on into extreme shortness of breath, chest pain. Eventually you could even pass out and then even die from asthma. Those are the common symptoms in adults. Kids are a little bit different. Kids tend to just have increased work of breathing. They can still have the wheezing and the chest discomfort, but a lot of times you'll just watch them where their chest will have to cave in and out as they breathe harder and faster.
And kids and adults can develop asthma at any time.
You can. Yeah, there's some predilection for it. Certainly if mom and dad had asthma, you might be more inclined to develop asthma. Certain diseases early in childhood can make you prone to asthma. RSV is one of those.
Oh, I didn't realize that. And other causes, or?
It
can just trigger any age, any time.
It can, yeah.
And it can go away as well, too?
Well, there's a lot of times we talk about the respiratory diseases early on in childhood because their airways are smaller. Irritations tend to be tolerated less often. As you get bigger and your airways grow, a lot of times people will, quote, grow out of their childhood asthma. And it's just because their airways have gotten bigger and they're able to handle some of the smaller volume changes to their lungs. So
what final advice would you have for our viewers going into these final months of the summer, the first part of the fall?
I think the biggest thing is just awareness. Awareness to your environment and what you're around, the quality of the air that you're going to be breathing. If you're going to be out and about on really high windy days, you just got to be prepared with your rescue inhaler.
Well, it's great information. We really appreciate your time, so thank you for being with us.
Thank you.
Doctor. And if you want some more information on the urgency room or about asthma, you could just go to theurgencyroom.com. We'll take a short break, and when we come back, what one of our local communities is doing to create a healthy environment for all of us. Stay with us.